Migraines with Paul Rosen.
Our diets, our Western diets in America are just really, you just don't realize how poor they really are.
What would you say to others who would like to feel better?
Sometimes you need to find the instruction. That's where the testing and everything comes in, because without that knowledge, there's no way I could have got to the point where I'm at today.
Straight talk about health.
And then I start preaching and telling them what I've been doing. And this guy named Paul Rosen has changed my life.
With your host, Paul Rosen.
By the way, the information contained in this program is not approved by the FDA, nor intended to treat, diagnose, or claim to cure any medical condition or disease as defined by Western medicine. However, skilled practitioners of many disciplines have found nutrition response testing to be a highly reliable supportive technology for assessing the health and fitness of the body's functional system.
You know what having a headache is like, Paul? Having a headache is like having, I don't know, what would you say, having a spike right into your head. Just like that. So our purpose this morning is to remove that spike from your head. That's what we're going to be doing this morning here on Health Matters, removing that headache and making you healthier. Right, Paul?
I was very curious. You know, there are over 300 million people that experience a migraine worldwide. 300 million.
That's a lot of people.
At least one. 32 million in the U.S. alone. That's climbing. 20 million migraine attacks per day. 25% women and 10% men experience a migraine. And a recent study showed that the loss of labor time, there's loss of money, lost productivity of migraine sufferers may exact a significant toll in U.S. business, according to the American Academy of Pain Medicine. 150 million work days per year, equivalent to 1,200 million work hours, are lost each year due to head pain, headaches, migraines.
A few things are worse than a headache, and especially a migraine. It seems like that chronic pain just keeps you from being able to do much of anything.
And the healthcare system spends between $5 and $17 billion on treating migraines.
And by the way, I said chronic pain, Paul. Can you tell me, are migraines necessarily something that you experience chronically? Can you
Absolutely.
Can you just have one every once in a while, though? Or do most people who have migraines experience them all the time?
Well, if you're experiencing a condition recurringly, that is, it recurs on some, then that's a chronic condition.
Right. And I guess my
question...
Acute
is something where, you, God forbid, get hit by a car. That's an acute situation.
That's pretty acute.
Fall from a ladder, fall from the sky. Fall on your head.
That would be sudden and acute.
And then you get head pain.
However, chronic migraines are the most common sort, I guess is the point I'm getting to. If you have migraines, you probably have them on a continuing basis, right?
And they probably occur because of certain triggers. That's a technical term that that a migraine sufferer who knows the word trigger has spent some time in the healthcare system, because that's the term that they use. And it could be, cyclical, with the weather or seasons or those types of things. And what we want to do with this segment is we want to really break through and understand how to solve the migraine issue, recognizing that almost all of the treatments for migraines are really management tools. They're not treating the underlying root cause of the problem.
So medication would be one of those management tools, I assume.
All of it, whether the medication, some serious drugs like Imitrex or Zomig or those types of things, prescription medications have considerable side effects to them, as we've talked on many occasions. And even the over-the-counter drugs, which you alluded to, and I'm sure you'll get to that particular fact, have, potentially severe, extreme side effects. And then, of course, the heavy drugs for pain medications, things like, the narcotic medications, hydrocodone and whatnot. And then the steroids, which are used as anti-inflammatories, and these things have potentially lethal side effects. So
these are all prescription drugs, right? This latter
the
half.
The steroids will be prescription drugs, the narcotics, of course, and the migraine-specific drugs are all prescription medications, yeah.
You mentioned triggers, Paul. Why are some more susceptible to migraines than others?
Well, that's an individual question. I mean, why is the sky blue? Why do we fall when we jump off a building as opposed to rise? These are things which are highly personalized, and that's one of the reasons why the root cause of these problems are rarely addressed, because people. First of all, the people in charge don't know how to identify with precision, with a high degree of certainty, the factors, which will affect one person to the next. Personalized medicine takes time, and it also takes the tools to be able to identify that. And unfortunately, Western medicine and even many of the alternative medicines cannot identify with the highest degree of certainty, with precision, the tools, the triggers for that individual. So we amass a number of triggers, things like seasons, things like temperatures, things like perfumes and fragrances, things like chemicals, things like all different types of things, food sensitivities, and these things can trigger. But I can tell you this. I can tell you that any person who suffers from a migraine has thyroid issues, especially if that migraine occurs around the sides of the head all the way to the front, including the eyes and sinuses.
So we can identify that immediately. You need to have a healthier thyroid to help you get rid of those migraines.
This is indisputable. At least it's indisputable in my clinic. That is to say that almost every single migraine sufferer that I have ever worked with also had a thyroid complication. And in order to deal with that, you have to discover what the nutritional deficiencies and barriers to healing are, because the medications, all medications, no matter, including herbals, right? Will do have side effects. There are side effects.
I assume those who may use herbal medications are seeking something more natural.
Correct. Yeah, correct.
And therefore they may feel that's safer, but if it's not effective, what's the point, right?
Well, it's not that it may not be effective. It might be effective. It doesn't have anything to do with effective or not effective. It does have less side effects. That is, the side effects are less severe, but it still potentially has side effects. And without identifying with precision what is actually vexing the thyroid, I like that word, vex.
I like that too.
Yeah. Vexing the thyroid, then, you're just shooting in the dark. You're just, using the shotgun method. If you're going to use methods which are not prescription medications would have the most severe side effects, then you're likely to do less harm, but you're not likely to find the actual root cause of the problem.
It's a Band-Aid, as these things often are. Also, you say effective, maybe with herbal medications. For example, you get temporary relief, but as you've indicated, Paul, you're just treating the symptom, right?
And let's not throw temporary relief out just because. I get it. I've experienced a migraine, so I get it. I know what it feels like. And having you just want any relief, any kind of relief is, because So I get that. But at the end of the day, if you continue with that pattern, then not only do the migraines not get addressed in any way long term, perhaps they even get more severe, but the underlying root cause, the organs and glands in particular, the thyroid, goes unaddressed, and worse things happen down the road, and you never connect them. The practitioners never connect them to that, and so and unfortunately, I must say that the majority of people that I see have gone that route. They use medications. They, try all different types of temporary relief, management relief, until eventually they, reach out for some crazy person like me who's doing something called nutrition response testing based on, kinesiology, and I get it. I understand it's crazy, and as I have always said and continue to say, that if you want unusual results, you have to use unusual methods. You cannot continue to use the same blood testing, the same hair testing, the same saliva testing, the same urine testing, the same skin testing. You can't continue to do that thinking you're going to get a different result. I had a new patient recently who was like scratching their head. Well, how come you didn't do any blood tests? How come you didn't? Well, this person had already had a number of those tests done by different practitioners. Why would that person think that my doing a blood test is going to give us any more information than the 5 blood tests that were done in the past?
Well, let me say this too. I think you're really shortchanging yourself. It's not crazy. If it gets results, it's good.
Well, when I mean crazy, I'm being
I know you're being
self-effacing. I'm being self-effacing. I get it. But it's different.
Well, let me say, too, that if it works, maybe it should be the first choice as opposed to the last choice. In other words, don't go through the medications and all this other stuff and then finally reach a point where it's almost unmanageable and decide you're going to try this particular method. Why not jump right on it and take care of yourself now?
As my grandmother used to say, from your lips to God's ears.
There you go.
Yeah. I've been doing this for, 25 plus years. And, the usual is people have to hear it, then they have to hear it again, then they have to hear it again. And maybe after the 12th or 13th or 25th time, right, some people realize that if you keep doing what you have been doing, you're going to keep getting what you have been getting, and we call that insanity.
Futility.
That's any person who is suffering from any chronic condition that wants to avoid the use of medications, because the problem with that is that once you begin down the medication road, right, it turns ugly quickly, meaning that anybody who's ever utilized a medication for a chronic condition, a chronic functional condition, and I'm referring specifically to functional issues, how the body functions and why it isn't functioning normally, then, you just go from 1 to 3 to 5 to 7 to 9 and by the time you're, 50 or 60 or, even 70 years old, you're on a handful or more of medications and your body doesn't know which way's up anymore. So, in my personal view, and for those of you out there who are listening, if you agree with me, this is just not a fate that I would wish on my worst enemy. It's death by 1,000 cuts.
Yes, it is. And again, there's almost nothing worse than a bad headache that debilitates you in many, many ways. What about lifestyle management, Paul? By that I mean stress and other things that can cause you to have headaches. And maybe there's even a chemical reaction when you're under stress or you're angry about something. I would think that would exacerbate whatever problems you already have, whatever is leading you to have migraines in the first place.
I think I know where you're going with that. And of course, stress is an issue, right? But the biggest and most important thing is, additionally, because, of course, if you're in a relationship that isn't working, you got to fix it or get out. If you're in a job that isn't working for you, you have to either figure out a way to handle it or change, right? If you're worried about this and that, take it from me as a major, that's my tendency, right? You have to take action which sets you free. And to set yourself free, to make the best decisions, right, you have to be making them from a base which is clear and healthy. That's been my experience. And the first and foremost thing, as you identified it, lifestyle, is to change what you put in your mouth. It's what you put in your mouth that is either the death by 1,000 cuts or the return of health by 1,000. I don't know what the analogy you use.
Spoonfuls
of sunshine, right? It's what you put in your mouth. And the problem is we as human beings, the sarcophagus that we walk around in, basically doesn't have all of the sensors that would be required to feel that death by 1,000 cuts.
Let's not say sarcophagus. That sounds too self-defeating. We'll call it our shell.
Our shell.
We have our shell that we lumber
otherwise
around
referred to as our flesh and bone body.
That's right. But we need to make that healthier, and obviously our diets are one way to do that. Lifestyle management, managing stress and things like that. And as you've indicated, Paul, also environmental factors.
Well,
chemicals that we expose ourselves
so first
to.
and foremost to the food, which would, with guidance, address the nutritional deficiencies that occur over a lifetime, and the fact that the food supply doesn't contain the nutrition that a human being needs to not just live but to thrive. And then secondly, the environment. And this is what you see in so many of the trigger lists of triggers for migraines. Things like, of course, fragrances, especially artificial fragrances. Oh my gosh, they are so horrible and so degenerative. People really don't understand it. I mean, I was walking in the farmers market yesterday down in Hollywood, and God bless them, but the men and women are running around wearing the same artificial fragrance. You couldn't. It was impossible to smell the fresh food on the tables.
It was that bad.
I mean, it's a stench you can follow all the way. It's just incredible. And the thing is, people don't understand that they're creating functional, chaos within their endocrine systems. I mean, I know I may sound like a total nut, but I mean, I can't tell you how disruptive the perfumes and fragrances are with people. Now, I'm not talking about essential oils like citrus oils, orange and lemon and lime, vanilla and those types of things. Those are uplifting and have no, there's no issue with them, and disrupting the endocrine system. Although you get far beyond that into the essential oils, and you can also create problems. But and people wear, we create scents for people out of essential oils, personalize them so that they're not disruptive. But then you've got, a dehydration is also another one. People oftentimes, aren't conscious about, how much pure, filtered, liquid that they're taking in.
One more note, you can get a free chapter of Paul Rosen's book, The Missing Piece. Just go to his website, acunatural.com, acunatural.com, and fill out the dialog box that pops up. Rest assured, no information you provide will ever be shared with anyone else. So, what are you waiting for? Get going on your personal road to wellness today.